Assalamu alaikum. Welcome back. In this video, I have discussed important 50 obstetric and gynecology MCQs. These MCQs are helpful for all nursing related exam preparation. So, if you are new in my channel, then don't forget to like, share and subscribe. So, without wasting time, let's get started. What is the normal duration of a human pregnancy? Correct answer is option C, 40 weeks. Which hormone is primarily responsible for maintaining pregnancy? Correct answer is option B, progesterone. What is the first stage of labor? Correct answer is option B, dilation. Which fetal position is considered ideal for delivery? Correct answer is option C, vertex. What is the term for the surgical removal of the uterus? Correct answer is option B, hysterectomy. What is the normal fetal heart rate range? Correct answer is option C. Which condition is characterized by high blood pressure and proteinuria during pregnancy? Correct answer is option B, preeclampsia. What is the term for a pregnancy outside the uterus? Correct answer is option B, ectopic pregnancy. What is the primary function of oxytocin during labor? Correct answer is option C, induce uterine contraction. What is the medical term for painful menstruation? Correct answer is option B, dysmenorrhea. At what gestational age is a fetus considered viable? Correct answer is option C, 24 weeks. Which type of pelvis is most favorable for vaginal delivery? Correct answer is option B, gynecoid. What is the most common cause of postpartum hemorrhage? Correct answer is option C, uterine atony. What is the main sign of placental abruption? Correct answer is option B, painful vaginal bleeding. Which condition is associated with excessive amniotic fluid? Correct answer is option B, polyhydramnios. What is the average duration of the postpartum period? Correct answer is option C, 6 weeks. What is the preferred position for a laboring woman? Correct answer is option C, left lateral. Which contraceptive method is most effective in preventing pregnancy? Correct answer is option C, intrauterine devices. Which diagnostic test is used to confirm pregnancy? Correct answer is option A, ultrasound. What is the condition where the placenta covers the cervix? Correct answer is option A, placenta previa. Which nutrient is essential to prevent neural tube defects? Correct answer is option C, folic acid. What is the term for milk production in the breast? Correct answer is option A, lactation. What is the normal weight range of a newborn? Correct answer is option B, 2.5 to 4 kg. What does quickening refer to? Correct answer is option B, the first fetal movement felt by the mother. Which type of deceleration in fetal heart rate is associated with umbilical cord compression? Correct answer is option C, variable deceleration. What is the normal range of amniotic fluid index? Correct answer is option B, 8 to 18 centimeter. What is the term for the first menstrual period? Correct answer is option B, menarche. What is the main risk factor for ectopic pregnancy? Correct answer is option A, pelvic inflammatory disease. Which condition involves severe nausea and vomiting during pregnancy? Correct answer is option A, hyperemesis gravidarum. What is the term for a woman who has given birth multiple times? Correct answer is option D, multipara. Which diagnostic tool is most accurate for determining fetal well-being? Correct answer is option C, non-stress test. Which hormone is measured in pregnancy test? Correct answer is option C, human chorionic gonadotropin. What is the most common indication for a cesarean section? Correct answer is option A, fetal distress. What is the recommended daily iron intake during pregnancy? Correct answer is option B, 27 mg. What is the term for the bluish discoloration of the cervix in early pregnancy? Correct answer is option A, Chadwick's sign. Which condition is characterized by the implantation of the placenta into the myometrium? Correct answer is option B, placenta accreta. What is the first sign of puberty in females? Correct answer is option A, breast development. Which fetal organ is responsible for gas exchange? Correct answer is option C, placenta. What is the most common cause of maternal mortality globally? Correct answer is option A, postpartum hemorrhage. Which condition involves hypertension and seizures in pregnancy? Correct answer is option A, eclampsia. What is the purpose of Leopold's maneuvers? Correct answer is option A, determine fetal position and presentation. What is the recommended interval between pregnancies to reduce complications? Correct answer is option C, 18 months. Which medication is used to prevent preterm labor? Correct answer is option B, magnesium sulfate. What is the normal range of lochia discharge postpartum? Correct answer is option B, 2 to 6 weeks. What is the safest position to place a pregnant woman to avoid supine hypotensive syndrome? Correct answer is option C, left lateral. What is the primary purpose of administering vitamin K to a newborn? Correct answer is option B, prevent bleeding. Which condition involves the abnormal implantation of the placenta over the cervical? Correct answer is option A, placenta previa. Which screening test is used to detect cervical cancer? Correct answer is option B, pap smear. What is the primary goal of antenatal care? Correct answer is option D, all of the above. What does APGAR stand for in neonatal assessment? Correct answer is option A. If you like this video, then share it with your friends.